Chapter 9, Part 4, Aggressive Treatments for Obesity. Surgical treatments for obesity. Number 1. Surgery for obesity could be an option if a person's BMI is greater than 40. Number 2. Surgeries decrease stomach size. It therefore limits food intake. Number 3. Bariatric surgery changes hormone production. Number 4. Long-term safety and effectiveness depends largely on compliance with dietary instructions. Deficiencies in vitamins and minerals are common. Severe obesity is classified as a BMI of 40 or greater. This is prevalent in about 8% of the U.S. population. This causes lifestyle changes, and modest weight losses can improve disease risks. An effort to effectively treat is bariatric surgery. Surgery is an option for people with the following conditions: unable to achieve adequate weight loss with diet and exercise, a BMI of 40 or greater, a BMI of 35 or greater, with obesity-related health conditions, which can include but are not limited to diabetes and hypertension, and risks and strong motivation to comply with post-surgery treatment plan. Surgical procedures for obesity is what we will be discussing next. Gastric surgery is used in treatment of severe obesity. The purpose of surgical procedure is to effectively limit food intake by reducing the capacity of stomach. In addition, bariatric surgery suppresses hunger and alerts metabolism by changing the production of hormones. Changes in appetite, food preference, and GI microbiota may influence weight loss. The results are significant. However, this will depend on the type of surgery. Most people experience dramatic weight loss and improvement in diabetes, lower blood lipid levels, and lower blood pressure. All of these will decrease the risk of heart attack, stroke, and cancer. The long-term safety of weight loss surgery depends on compliance with dietary instructions. The surgery limits intake and reduces the absorptive surfaces, which decreases vitamin and mineral deficiencies. And you can see from this illustration the 3 types that are listed there. The first one is the gastric bypass, which is the most invasive. At this point, you can see where the surgical staples are. It makes a small pouch in the stomach, and then it reconnects and brings up part of the jejunum, which is the second compartment of the small intestine. So it bypasses the stomach, the duodenum, and part of the jejunum. In gastric banding, the surgeon creates a small gastric pouch using an inflatable band placed near the top of the stomach. The band is tightened or loosened by adding or removing fluid via an access port placed under the skin. So with this procedure, there is no malabsorption taking place. It just strictly limits the capacity of the stomach. However, the full stomach is still there, so you're not going to have the vitamin and mineral deficiencies that you would normally see with a gastric bypass. In a gastric sleeve, the surgeon removes 70 to 85% of the stomach and staples the remaining portions together to create a vertical tube shaped stomach with limited capacity. And this, just part of the stomach is removed to make a sleeve, and you still have the first compartment of the small intestine connected. So it's removing part of it to just make that sleeve versus the pouch that the stomach usually has. Other procedures for weight loss can include intragastric balloon, which occupies a space in the stomach, and it causes fullness. It's less invasive, less expensive, and easily reversed. Also, there's liposuction, which is a cosmetic surgery procedure, and that's basically to alter the shape of a specific area by removing fat. However, liposuction does not provide the health benefits typically accompanied with weight loss. That concludes part 4.